Middle ear infections are the most common type of earache in a child, and almost every child will develop an ear infection before their 3rd birthday. These infections usually develop when either a bacteria or a virus infects fluids that builds up in the middle ear behind the eardrum. This can often be caused by congestion that blocks drainage from the ear to the sinus area, and when it runs its course, usually this fever goes away. Sometimes the fluid doesn't go away because that tube is blocked, and that can cause more chronic ear issues. So, do ear infections tend to happen with colds? Most of the time, the answer is yes. So if your child has nasal congestion, they're coughing, they're sneezing, look for things like they're pulling on their ear, they have a higher temperature, they're not eating as well because they may not be able to swallow or chew, they're not sleeping. A more obvious sign is fluid coming from the ear or an unpleasant smell near the ear. Finally, the child's not hearing as well because fluid trapped behind the eardrum may reduce hearing as the eardrum cannot vibrate normally. So, let's say we've got an ear infection. Do they all need treatment? It depends. To be honest, the majority of ear infections will clear up on their own. It usually may take a few days for this to happen. Main goal during this time is to use medication just to help the child be comfortable. Usually for kids who are 3 and above and can communicate, we may give several days of watchful waiting to see if the infection goes away by itself. Younger kids, we may be more aggressive. For the kids where we have to treat with more than just medication for pain, we may start an oral antibiotic for 7 to 10 days. Again, ask us our opinion, have us look at your child. We can help determine the best need for antibiotic versus using pain medication first. Some children like to collect ear infections. How many are too many, and is there ever a need for surgical care? Usually we will talk about surgical care if that fluid in the ear stays for 3 or 4 months after an ear infection. And it may cause changes in hearing and or speech. Sometimes we'll look in the ear and chronic ear infections may change how that eardrum looks. That makes us more concerned. Now, some kids, again, will get recurrent ear infections, and if they've had more than 3 infections in 6 months, roughly, or 4 infections in a year, and they have trouble with hearing, and they have trouble with speech, we may have our ear, nose, and throat colleagues think about putting tubes in. So look for the child who's not hearing as well, who's talking more softly, a lot of huh or what going on, or that television is a lot louder than it should be. So if there's concerns about hearing, that's one reason why we should get involved. We talk more about evaluating speech and language, especially in those first few years of life. So if we've got a child with recurrent ear infections, trouble hearing, speech issues, or other complications, we may talk about ear tubes. Ear, nose, and throat doctors insert them through the eardrum. These allow fluid to exit the middle ear and drain from the ear. They are ventilating tubes, and they prevent recurrent ear infections by allowing that fluid to drain out of the middle ear. They're pretty small. They're about the size of a pen tip and made of silicone or plastic. They allow time for the child to mature and for the tube that drains the ear to the throat to work more effectively. Most of the time by age 5, that tube is larger. There's less need for tube placement. If a child does have tube placement, they usually fall out on their own 6 to 12 months down the road. So let's not forget we can reduce the risk of getting ear infections. The less we're exposed to cold viruses, secondhand smoke, and bottle feeding after age 12 months, that can reduce the risk. If there's washing hands frequently, again, having no smokers in the home or secondhand smoke, and using a cup instead of a bottle, they can help reduce the risk. We also know certain vaccinations, including the flu vaccine, can reduce the risk of ear infections. So if you're concerned about your child, both acutely with pain in the ear, discomfort, use medication to help with pain, then give us a call. If you're concerned about longer term issues like recurrent ear infections, speech or hearing, we can be of help. Active Kid MD.